this tiny capsule has been called everything from a miracle supplement to a myth. They say it prevents death, increases immunity, and even prevents autoimmune diseases. But does it really? Today, we're taking a deep dive into vitamin D, the sunshine hormone. So let's separate the hype from the hard data. Vitamin D isn't really a vitamin at all. It's a hormone precursor. When sunlight hits your skin, UVB converts cholesterol into vitamin D3. Your liver then turns that into 25-hydroxy vitamin D. And that's the form we measure in your blood. Your kidneys then finish the job by converting it into 125-hydroxy vitamin D, the active hormone that helps regulate calcium, phosphorus, immune function, and gene expression. Vitamin D receptors are found in almost every cell of the body. Muscle, bone, immune cells, and even your brain. That's why low vitamin D levels have been linked to increased risk of everything from fractures, muscle weakness, cardiovascular disease, depression, and even autoimmune disorders. But correlation is not causation. So let's look at what the intervention data actually shows. The VITAL trial followed 25,000 adults taking either 2,000 IUs of vitamin D a day or a placebo. The result? No significant reduction in cancer or cardiovascular events. But the same data set hinted at a small but meaningful 22% reduction in autoimmune diseases. We'll get there soon. Meta-analysis from journals like the BMJ shows something interesting. Vitamin D supplementation doesn't lower all-cause mortality dramatically, but it may significantly reduce cancer mortality, especially with consistent daily dosing rather than mega boluses. So it's not a longevity pill, but it may tweak your odds. This is where things get really exciting. In 2022, the VITAL autoimmune study found that 2,000 IUs of vitamin D3 reduced autoimmune diagnoses like rheumatoid arthritis, psoriasis, and lupus by about 1/5 compared to the placebo. The benefit was even greater when combined with omega-3 fatty acids. Why? Immune cells like T cells and dendritic cells have vitamin D receptors. When active, vitamin D binds there. It helps modulate inflammation, essentially telling your immune system, calm down, stop attacking your own tissue. When it comes down to it, most of us are not getting enough vitamin D. Indoor jobs, sunscreen, higher altitudes, darker skin, it all makes us deficient. Typical candidates for supplementation include people who live above 35 degrees altitude, people with darker skin, older adults, and obese adults. Also, anyone with IBD like Crohn's, ulcerative colitis, or even celiac. Studies show that the average American serum levels are about 20 nanograms per milliliter, which is the bare minimum considered sufficient by the NIH. But many experts aim for 30 to 50 or even 70 nanograms per milliliter. With all that being said, there are some risks. Vitamin D toxicity is rare, but real. Taking 10,000 IUs or more daily for months can cause hypercalcemia, causing confusion, nausea, kidney stones, and even calcification of the arteries. Women's Health Initiative also found that combining vitamin D with high calcium intake raised kidney stone risk by about 17%. So how should we supplement? For maintenance, most people can get by with 1,000 to 2,000 IUs a day. If you're low, a clinician might prescribe you 5,000 IUs a day for short term, and then retest for about 8 to 12 weeks. The NIH upper safe limits is about 4,000 IUs a day long term. Remember, balanced sun exposure, diet, and supplementation. Vitamin D works best when it's part of a full lifestyle. Sleep, movement, and nutrition balance. Vitamin D isn't magic, but it is foundational. Deficiency makes our bodies fragile, and sufficiency makes our body resilient. It may not add decades to our life, but it could add quality to the years you already have, especially when it comes to immune balance and vitality. If you haven't checked your levels yet, maybe it's time to step into the light. If you found this helpful, hit subscribe for more deep dives like this. Until next time,